decade, India has witnessed an unprecedented transformation in its healthcare landscape, driven by the convergence of technology and medicine. The digital revolution has not only accelerated the delivery of healthcare services, but has also played a pivotal role in advancing the goal of achieving universal health coverage. When we talk about digital health, we're talking about strengthening primary healthcare systems, improving universal health coverage, and timely and relevant data for decision-making and resource allocation. Most importantly, we're talking about equity so that no one is left behind. Digital technology is emerging as a key enabler of healthcare delivery in India. And to talk about accelerating digital transformation in healthcare, we have with us an esteemed panel. Let me welcome them all. We have with us Professor Rajendra Pratap Gupta, founder, Health Parliament, and former advisor to the Union Health Minister, Government of India. We also have with us Dr. K. Madan Gopal, advisor, Public Health Administration, NHSRC, Ministry of Health and Family Welfare. And we have with us Mr. Neeraj Jain, Country Director, India Path. Thank you all so much for joining us today. Dr. Madan Gopal, I would like to begin with you here. The first thing, we know what the government has been doing. We have the Ayushman Bharat digital mission. And the scale they're working on, it is to ensure that everybody has accessible health, it's affordable, it's also inclusive, and we ensure health in a timely and safe manner. Could you tell us the building blocks of the national digital mission? I think that's the first thing we should start talking about.
Okay, thank you. Thank you for this opportunity to share my thoughts. One of the important things which you have highlighted when we were struggling for rolling out of PMJ program, at that time it was called as National Health Protection Scheme. When it was launched there, we were struggling to have a software. And we could manage a software, we could identify a software. Then the thought process started that in the health system, we are having so many portals. You name a program, you are having a portal for that. But a single person information is collected by so many portals. So can't we have a unified portal? That kind of thought process emerged after the initial rollout of this PMJ program. Besides that, in the national health policy also, we have talked about integrated health, digital health infrastructure, so as to improve the access and availability of the services. That was there. That was the guiding principles on which this paradigm started.
Okay.
Then after the rollout of the PMJ scheme, then the national health stack was prepared, so that we thought that we should be having a stack in which all the this portals data can reside, and which a common identifier we can access all the information. It can deduce some sense. We can deduce some sense and analyze that data.
Okay.
Then this feeded into a committee was constituted, and this feeded into a formation of National Digital Blueprint. And this National Digital Blueprint formed the building block for this National Digital Health Mission. Many of the building blocks are there. We are having the digital blueprint architecture for the country, how the health digital architecture will look like. And some of the building blocks are being rolled out as the National Digital Mission. That's one thing.
Okay.
And what we are doing with this digital mission is we are trying to create an ID for the beneficiary, ID for the hospital, ID for the healthcare providers, and ID for the pharmacy.
Yeah.
And this ID, as I mentioned, that so many information is collected. If it is embedded into the record of the patient, when we enacted this Clinical Establishment Act way back a decade earlier, so at that time, the vision was to have 1.3 billion electronic health record.
Yeah.
And we can have a portable, accessible digital record on which we can deduce some algorithm out of that to have a common identifier and create an electronic health record from that. That was the whole thing. At that time, we had the vision for 1.3 billion health records. And after the launch of this ABHA ID, that ABHA ID would be used for embedding into the electronic health record, so that a single identifier is there and that information can be used across.
Easily, yeah.
When a single identifier in the health record is there, then you can make algorithms, you can run the machine, you can at least tame your machines, and machine learning tools and other things can be made. That's one thing. Second thing, in the digital landscape, you see before COVID, all digital consultations, the telemedicine, they were viewed seriously by the honorable courts, as there were no practice guidelines.
Okay.
During the COVID time, for addressing the continuum of care for the morbid people, so these practice guidelines were released. And you have seen that how it has opened the it has given a leapfrog into the digital
Absolutely,
ecosystem of the country. And you have seen lot many things which have happened.
Yes.
And one of the important thing, because let me finish it.
Yes, absolutely.
One of the important thing which has happened, I have told about the access and availability of the services. If you look at we are having two systems, one is public system and the private system. Private system is more or less focused in the tier 1 cities and some presence in tier 2. And if you go to the tier 3 and down, very scattered presence is there.
Okay.
But the public system, you can have a system right up to a village level, which would be provide an extension outreach services are being provided to the health volunteer, ASHA volunteers. We are having 1 million ASHA volunteers. Then to augment the services at 3,000 to 5,000 population, we are having the Ayushman Arogya Mandir, which was erstwhile sub-health center providing 6 services. But through this Ayushman Arogya Mandir, we are providing 12 assured services to the population, at 3,000 to 5,000 population. Above that is primary health center, then the community health center, district hospital, and subsequently in the coming days, in all the districts, you will be having medical college. That's the system is there. But the challenge here is how to provide specialist consultation.
Yes.
If a villager goes to a district hospital, if the specialist is occupied, the specialist, and he has to wait for whole of the day to get the specialist consultation.
Yeah.
But after these practice guidelines were released, we are now trying to leverage the technology, and this doctor-to-doctor consultations can now happen at the Arogya Mandirs.
Every level,
at that level, so that the villagers walk there. As a result, he need not to travel to the district level or some other specialty centers for getting a specialist services, so that consultation happens there, and free of cost medicines are being provided. Yeah. Apart from that, this e-Sanjeevani platform which has been made as a result of the telemedicine practice
the telemedicine, in fact.
The patient on the web portal, he can have doctor-to-patient consultations also.
In fact, I want to come, my next question to you would be on telemedicine, because that has been a change maker. Before we come on to that, Professor Gupta, I would like to ask you, Dr. Madan has told us about the government, what really are the building blocks and what has been happening. How can technology and digital innovation bridge this gap when we talk about diagnostics, screening, and delivery of healthcare? Because we also have a huge shortage of doctors, nurses, and healthcare workers.
So I think for digital health, first we need to understand the scale, the scope, and the scale, all three. There is understanding that telemedicine is digital health, which I guess is a very small component. And as AI matures, as generative AI comes in, you will find that there will be much more use cases than just the teleconsultations, which today is synonymous with digital health. So that being one, and I think e-Sanjeevani, if I go by numbers, we had 190 million consultations till yesterday, and yesterday itself was 297,000. You can understand the scale, at which India is leapfrogging on digital innovations. We already have almost 500 million ABA numbers. So we as a country have become right on the top in terms of digital health numbers. Now in terms of scope, let me come to. So we talk about diagnostics, we talk about screenings, but technology can allow us to go one step before that, which can be health risk assessment, which is non-invasive. So all of us know our medical history, our family history. So we can actually understand that which is an at-risk population, who is at-risk individual. So I think the entire country should first do a health risk assessment for every individual. That's based on your data that's available with you. With that, we can identify, does anyone or everyone actually need screenings? Those who are at risk, you for sure have to. Anyone in the family with chronic diseases, screen their entire family. Our experience is when you screen people with having chronic disease history, you will identify people who are at the borderline or at risk already. So I think screening is one innovation that we should, health assessment is one thing that we should do. And then let me come to the scope of what these new technologies can do. So currently we have ASHAs, which are first responders. We have 1 million of them. I believe that as the data gets more clean, more baseline with really good clean data, these ASHAs will become AISHAs, which is artificial intelligent back ASHAs, which actually means no physical ASHAs needed.
Okay.
I mean, a mobile phone with an AI backed chatbot will do a much better job than ASHA does today. The question will be, what do we do with million ASHAs? So the scale and scope is phenomenal.
Yeah.
In terms of using a clinical decision support tool, based on that. I mean, if you really look at my bigger challenge in terms of technological innovation that we really need to look at, and this platform by NDTV is probably one of the most impactful ones, so I want to raise this issue. We have done a study where small hospitals, which provide 80% of India's healthcare, they are at risk of crisis of existence, you know. So 1 out of 2 have told us we want to wind up. If someone is want to buy us, we are willing to sell. So I think technology innovations can help them be sustainable. If we make them do that, we'll be actually addressing the biggest issue of affordability and access, because big hospitals don't provide care in the tier 2 and tier 3 cities. And that being said, the last thing that I would say is that the human capacity building is more important here than anything else. So that looks like something basic, but that I think is one innovation we need to do at scale.
I think even what you said about, the aspect of, screening in time before risk, which is again the preventive approach, which rather than actually looking at cures, that's something also very, very interesting. And we're going to be, of course, discussing that. Neeraj, Professor Gupta did speak about artificial intelligence. I think I would like to touch a little bit on that. Could you tell us the role that artificial intelligence can really play in accelerating digital health even more?
Sure. Thanks, Ambika. I think before I go there, I just want to pull us back a little bit. There's something that we say very often at PATH, which is it's not about digital health, it's about health. And digital is just a means to get there. Yeah. So I just want to bring this audience to that reality that we are actually trying to have health impact. And the reason why digital becomes important is because, A, we are a large country, 1.4 billion people. How do you actually reach so many people? That's a challenge. We don't have as many trained human resources to be able to do that. So that is where digital comes in to be able to actually help us leapfrog and to be able to reach and provide access to a lot of these people. We looked at artificial intelligence. We've been looking at it and looking at what are the uses. And of course, new uses are going to emerge as we go along. But if somebody was to ask me in the next, let's say, 1 or 2 years, what are the big things that AI could do for India, for India's health equity? I think one is going to be screening and diagnostics, and Professor Gupta actually touched on that. If we want our primary healthcare, centers to be able to actually do population-level screening for disease, we will have to use technology and digital. We will have to screen at a population level through technology. And I can tell you, as we speak, there is already, cervical cancer screening, which is happening through AI, breast cancer screening, which is happening, tuberculosis screening, which is happening through AI. So that is screening. It's not a confirmatory diagnostic, but what you're able to do is you're able to screen large populations. Then, of course, the diagnostic piece. Again, you can digitally use diagnostic tools. That data can also come together. One of the big challenges that we have currently is how does that data come together? How does it all tell us about our, the landscape of disease in our country, and how do we respond to that? What are we going to do to actually respond? So that data could actually be brought together through connected diagnostics. And that's a huge, huge part of, or the role of AI. That we're going to see. The second big one, and I'm sure all of us are worried with this new variant of COVID that seems to be emerging. The second big one for us is actually being able to have information which is layered based on, based on climate, based on health, information which is coming from all different sources. And we are using the power of AI, the power of computers and digital to be able to predict hotspots, to be able to figure out where we should be thinking first. Again, we are a large country. Where are we going to go first? How are we going to go about it? What are the interventions that are needed to be able to stop the next pandemic? And that's all going to come through the data, through surveillance, and then layer multiple data sets on top of that to be able to predict. So we've used that in tuberculosis. We've used that in malaria in India. Small geographies, we are doing it in UP, for example, in PATH, where we're looking at malaria, dengue, trying to predict outbreaks and really get in there before things go bad. But this could be a great use of AI. So I think these are the two that I'll stop at, but there's a whole long list.
Okay. Now, since you've told us about AI and Dr. Madan, you were telling us about telemedicine. We've all heard about it, and eSanjeevani has been recorded as the world's largest telemedicine program. It has been a game changer. We've seen that, like you said, in the remotest parts of the country where you couldn't get a specialist, people had to travel for hours, or somebody would actually be at such a serious level where they couldn't go to a specialist. What are your thoughts on that? Because even for mental health, we see people reach out as somebody to talk to, and that's been quite a game changer, very, very popular.
You see how this telemedicine practice guidelines has been a game changer. Because when the first wave started, so at that time the Arogya Setu app and the surveillance mechanism and the other things which were inbuilt into that, it had worked better.
Yeah.
When during the second wave, when the virus outpaced our preparations, at that time this telemedicine practice guidelines along with the digital aids, it has come to our rescue. Otherwise the situation, you can imagine of a situation where we would have stood. One thing which has happened is through the command and command centers, you were contacting the people who are at the home, and you were providing consultation through that. That was the earliest gains which we had through this. Then through this eSanjeevani also, you see the consultation, the reduction in the time, reduction in the wages of the people. The people, if you see how the healthcare is being utilized among the masses, they usually will go to the district level or the community health center on a bus. The bus is usually in the morning or in the evening, at once a day. It will come back in the evening. If they are going there, whole of the wages are lost. Plus, depending on the availability of the doctor is not that he would be on duty, but he might have been called at the higher centers, or he would be in the operation theater or something. So the consulting for getting a specialist consultation was very difficult. But you see what has happened, doctor to patient consultation, like Dr. Gupta has already mentioned, we have reached that figure. It was not an easy thing. So as an add-on to this, and phase 2 of this eSanjeevani, now we are having point-of-care diagnostics as well as the other high-tech things, so that the diagnosis can happen, the even investigations can happen, and a prescription can be generated then and there only. But only thing, looking at the success of that, during the last year's budget also, the Telemanas was also released.
Okay. Yeah,
so you see that how the utility of this telemedicine is proving now.
And it's ensuring that healthcare reaches everywhere, last mile connectivity. Everywhere. Absolutely.
You see the utilization of the Telemanas, specialized services. Now they are trying to see that how to make it 24/7, how to Uberize all the network, so that if I want to speak in Bengali, so immediately my call can be transferred to a Bengali-speaking seat.
So that you're comfortable as
so
well.
So that kind of challenge is there. One of the because in the private sector also, many telemedicine service providers are there. But the biggest challenge of eSanjeevani is whether these consultations will result if some hospitalization or some care is required. So how to provide that thing? That's the challenge.
How do you go to the next level?
How to connect with the hospital so that what has happened during the COVID time, after the consultation, so I was with the patient, connected with the patient for 2 days, 3 days. After that, when the saturation level dipped, when the temperature was not resolving, immediately the network people used to say that now you have to go to the hospital and get yourself treated. But at that time, availability of the bed was one of the difficult challenges. And even after the bigger players also, they could not ensure a bed into the hospital after teleconsultation.
But anyway, I think it's begun, and since we are talking about challenges, I think I have a question for you, Professor Gupta, which Dr. Gopal had said about creating that ID, that one ID which we have. But again, a lot of people, the risk, how do we protect patient data? That's one question I would like to ask you. Because a lot of time people wonder, because that one ID is my life or my health, is everything in the open. How do we maintain that privacy?
Before that, I would like to add to what he said. In 15, I led a study in AIMS and RML. So average number of doctor a person sees before coming to AIMS is 6. By that time, the case is beyond repair. So I think telemedicine has bridged that huge gap. And what we need still to do is, we still know that patients come to AIMS at the last stage. So as a part of eSanjeevani, since this is a platform and I'm sure it has an impact, we need to make sure that using AI at the base level in primary care settings, at the sub-centers level, we can reduce our infrastructure cost by moving some of the stuff on the mobile phones where people can have the consultations at hand and invest that money back into secondary and tertiary care services. So like AIMS and Tata Memorial should have their own specialized service referral program. Like we have the virtual tumor board, which can be a phenomenal thing. I don't know how many people know virtual tumor board, but virtual tumor board discusses complex cases with network of oncosurgeons.
Okay, so
And this is something which is a boon for people. You know, you will get all consultations happening with specialists across the country. Now, coming to your point, and I think that's where the third part of scale, scope, and scare was. The scare is, we read recently that 81 crore people's, data was breached in ICMR. So let me tell you one thing, that we are trying to overly focus on this. Anyone sitting in this room, I can assure you, your social media knows more about you than you know yourself. So just simply worrying that ABHA ID will create a scare for me, my data is gone. Anyway, social media knows more about you, your habits, what you like, what you don't. So let's not, I think the benefits far outweigh the disadvantages, but we have not been able to communicate. Let me accept that too.
okay.
I think we need to see what's the value in having a unified health record. So a lot of us don't know that one medication we take with the other is going to have maybe a, interfere with each other. And this can lead to a lot of complications. So I can just tell you in 30 seconds a case. Their mother went for a delivery in a hospital in Bombay, and my friend, a gynecologist, told his assistant, typically as they do, give anesthesia, I am coming for the delivery. When they delivered, later when he opened, there was a operation mark there. He came and asked her that, uska heart surgery hua tha, bola usse aapko kya matlab hai? Just imagine what happens. He said, मैंने anesthesia दे दिया, अब ऊपर वाला दिखेगा. If this was an electronic health record or on the longitudinal health record, they would have known you can't give this anesthesia. This already has got a heart surgery done. So I think the history itself is a part of your treatment, and for that you need to have ID. There is no two thoughts on that. If people are in doubts, please stop that. Start using ABHA ID. Government has pushed in a lot more in it. And I think there is something we shouldn't worry about, the scare of losing records.
No, I think you've clarified that really well. I mean, of course, the advantages are much more on that. Neeraj, again, the pandemic has brought about a shift when we talk about the diagnostic market. You did touch upon a little bit on that. But how are we reinventing that, especially when we talk about accelerating? That's what we're talking about, digital health. Tell me a little bit about the diagnostics.
Yeah, I think, before the pandemic, none of us knew what an RT-PCR test was, right? We all kind of know what it is, but we only think about it as a COVID diagnostic. But RT-PCR can do a lot more. I think the importance of knowing your health status came up front during the pandemic. I think that's what we learned, not just in India, but across the world. And because of that, I think, there's been a huge push towards improving diagnostics. And I must say that, as a country, I'm a very proud Indian that from having minimal RT-PCR labs when COVID hit, we had too many probably, and it was over a period of months. But just coming back to the whole idea of universal health coverage, because you started from there, Ambika, and universal health coverage is all about primary health care, and primary health care is all about screening and diagnostics. So if you're able to screen,
earlier you pick up something earlier,
that's what's going to make the difference. Now the challenge is, with all that data coming together, if you don't have a digital solution, you're asking people to enter data, and that in itself becomes a challenge. So the digital backbone that the government of India has created, the Ayushman Bharat digital mission, and the way it is structured, all labs will be connected into that, all private sector providers will be connected into that, all big hospitals, everything will be connected into that. That's the dream, right? That's where we want to go. And I'm quite hopeful that we'll get there in the next few years. But that screening and diagnostic using and data coming into that digital system is not only going to help the individual, because as Professor Gupta was saying, it will tell me about my records altogether, but it will also help us as a country, as a community, because you've got data from the entire country coming together. You've got data for decision making. You can actually think about what's happening. I mean, today we are reading every morning last 4 days, we've been following this very strongly. 20 cases today, or 20 deaths today, or 3 deaths today. And I mean, all this data, we're not even sure if we're getting data from every part of the country. But digital will make that possible. So the entire piece of surveillance, what we talk about disease surveillance, will only come together once all diagnostic data is coming together into one system, and we're hearing about it. And remember, Ambika, the private sector or the private healthcare providers are going to be absolutely critical.
Yeah.
And we've done that in TB very successfully in India. We have to do it across all diseases because even now about 50-60% of our healthcare providers or healthcare provision is given by the private healthcare provider.
Yeah. So
We all go to private healthcare providers, we don't go to the public health system, many of us. So unless we have that data too, we're going to miss out. I'm really excited, for the way that the whole backbone has been set up.
Yeah.
Now it's just about implementing, and we have to get in there. And I can tell you, at Path, we are doing a lot of work around that, just to ensure Abha IDs are created, healthcare providers are on that system, and data starts coming in.
Neeraj, since you said healthcare providers, I would like to come to you, Dr. Madan, about healthcare professionals, training them, because many times, we've all learned, Zoom, Teams, this is something like you said, like the RT-PCR said, we learned it then. How about training? How easy, how difficult is it to train healthcare providers through an online platform?
Ambika, thanks that you have asked this question. When the COVID started, we wanted to standardize our treatment protocol. That message has to reach many people. And you have seen how the online platforms, they have evolved during that time. And we have utilized these platforms to the maximum for reaching to the primary health center doctors. It is through the online platforms only. Apart from that, we do have a Shashak portal, which is for online training for the screening of the NCTs and other things. Then iGot platform is also there. These are all online platforms which are available for improving the performance of the people, so that the message which we are having, so that percolates to the lowest level as possible. You take the recent example of the COVID variant of interest. It's a variant of interest. But still that information has percolated right up to the lower level, so that the message and the other things are being given by the doctors and other things. So besides that, Center for Excellence is there. So for training the people in specialty level kind of things.
Okay.
So a few practical experience are required, but the theoretical and other aspects are being taken care by these online platforms.
Okay.
Even we are supposed to go to the login and undergo some training and other things. We are also supposed to do that. That kind of mechanism has been established in the government system,
yeah.
that everybody has to undergo that training. And at least if you go to the iGot platform also, it usually says that what is your eyeball span, so that it's not that you just opened and closed it. You have to run the video for that particular duration, and after that you have to answer a few of the questions, and based on that some score is released, and you have to clear that score before you get a certificate out of that.
Okay.
That means that interactive mechanisms are there, and it has found to be very, very useful.
Yeah. At least they're learning. Everybody has to evolve. Professor Gupta, just want to go back a little bit. Just for our viewers, if you could tell us what is the most important aspect of digital health? We've spoken about it. We've spoken what the government is doing. But according to you, what is the most important aspect?
Understanding digital health. That's, I'll say first, we said we are starting with digitization. So there are three aspects that I think people need to understand: digitization, digitalization, and digital transformation. And anyone into healthcare, if you don't do by 2025, I see no reason why patients would expect to interact with you. That being said, I think, Ambika, I would have a very important message. I think we are talking about digitalizing India. If we really want to do that, we need one big change. And we have to learn from our Mars mission and the Moon's mission and the Department of Science Technology. One thing that I have a very important takeaway from these success stories is the Department of Space is headed by a space scientist, Dr. Somnath. Department of Science Technology is headed by a scientist right now, Abhay Karandikar. I think we need to get bureaucracy out of Ministry of Health and have health professionals headed, else we are not going to go anywhere. Wonderful Prime Minister, one of the most popular leaders in the world, the one who is a doer, a visionary. But bureaucracy is one of the biggest stumbling blocks. Sorry to say that, but even this platform, I don't say that. I do disservice to my healthcare professionals. So if you want to really have digitalization happening, we have a National Health Authority, but still bureaucracy is a stumbling block.
Okay, so that's your, that's an important
That's a
thing
very
you feel.
important
Okay.
message for digitalization of India.
Okay, so that's your most important aspect. Neeraj, we've been talking about the challenge. We've spoken a lot about it. I think something which I really want to ask you is about collaboration, partnerships, because that really is critical for universal health coverage. And you did speak about UHCs. Tell us, because PATH does work with the government, how can we make this more of a people's movement? Of course, it's digitalization. How do we make it accessible? How do we make it more affordable for all?
Yeah, thanks, Ambika. And this is all going to be about collaboration. I think if I just look back at the year that we've just gone through, the G20 presidency, Government of India took a very, very leading role in the conversation around health. And the initiative, the global initiative for digital health, was launched during the presidency. Huge shout out to the Government of India, the Sherpa, and Mr. Love Agarwal, who was leading our health working group. And that's actually going forward. So we are actually leading, we led this effort to look at how we are going to collaborate with the rest of the world. And when we are talking about the rest of the world, we are essentially talking about low and middle income countries. So in a way, India has achieved so much through the last, I'd say the last 5-6 years. We have achieved so much in digital health and the building of the infrastructure, the back end. I mean, I was talking to somebody from Holland and they said, I wish we had something like that there. And the structure is fairly different there. I mean, I'm not saying that he said theirs was bad, but this whole idea of open interface and people can actually just come in, be part of the sandbox, bring in their solutions. So it is all going to be about collaborations. It's going to be about open platforms. It's going to be about digital public infrastructure, which we are talking about quite a bit. Again, we landed one of the largest global agreements on DPIs during the G20, and digital public goods. We have to bring digital public goods. For e-Sanjeevani, for example, I would want to see e-Sanjeevani go to other countries, and be able to support some of that work. And I know that Government of India is very keen to do that. Yeah. So that's going to happen soon.
Another step forward.
Absolutely. So collaboration, global, all, South-South collaboration is going to be key. And I think India has got a great, strong position there. I think LMICs are going to all come together. So that's a big one. But even within the country, private, public, academia, we all have to get together if we want to get to universal health coverage. So,
and when you actually so well put, because when you rightly say, right, everybody needs to work together, you also see the amount of startups, the way they get, like the way we can work here, that's for other countries, and India can be a great learning experience for them. So before we wrap, a quick line for your closing remarks, what you really feel. So I'll start with you first, Dr. Madan.
Thank you. One of the things is we have to adopt technology. We have to see that how quickly we adopt technology, and technology should be building capacities. So it should not be that somebody would be come and teaching us the technology. As we have learned to use the WhatsApp, we have learned to make reels from Facebook. Nobody has taught us. Whatever technologies we are using, it should at least bring some value to that. If we are able to add value to the technology, then things will happen.
So adopt technology and capacity building. Over to you, Professor Gupta.
If you're not in digital health, you are not in healthcare.
Okay, that's a great one.
That's a strong statement, but yeah, I would kind of tend to agree with you. No, I think it's all going to be about speed of execution, because we've done enough policy, we've got it all there. How are we going to deliver on the ground, and how fast? I think that's going to be important. But I must say, we'll meddle and we'll figure it out and we'll course correct as we go along.
Yes, actually implementation. It's been a pleasure to have you all. Thank you so much, Neeraj, Professor Gupta, and Dr. Madan for joining us. So digital transformation in healthcare is inevitable, and it is an ongoing process that is constantly evolving. India has the potential to emerge as the world's leading provider of digital health solutions. Ayushman Bharat Digital Health Mission has already started India's big push for digital health. Technology adoption is the key of solving India's challenge to access of a more equitable healthcare system, helping address challenges of accessibility, affordability, and quality.